All right. So, hello everyone, and thank you for joining Stop TB Canada's Stop TB Canada's World Tuberculosis Day webinar. My name is Lee Raithby. I am a Senior Policy and Advocacy Officer with Results Canada and part of Stop TB Canada's Secretariat team. I'm joining you today from Toronto on the traditional territories of the Wendat, Haudenosaunee, and Mississaugas of the Credit First Nations. As well as we explore today's topics, we acknowledge the disproportionate burden of TB that is felt by Indigenous communities and the ongoing outbreaks that are continuing to affect many communities across Canada. Through all of Stop TB Canada's work, we emphasize the connection between protecting the health of people in Canada and the ongoing work of reconciliation. We'd like to thank all of those working on the front lines and behind the scenes to help realize Canada's commitment to ending the TB epidemic, and we stand in solidarity with all those who have been affected by this disease. We are just 10 days away from World TB Day and thought this would be the perfect opportunity to bring our network together to reflect on Canada's role in the quest to end tuberculosis, provide a bit of an update on the work that Stop TB Canada has been doing to accelerate Canada's efforts in this fight, and hear from some TB experts on where they see the greatest need as well as areas of hope as we get closer and closer to the global targets of ending TB by 2030. To start, I would like to pass it over to Monica Shandel, a member of Stop TB Canada and TB People Canada, who will share her personal account of how TB affected her life. Monica, over to you.
Hi, I'm Monica. I'm a TB survivor, and I battled TB from 2020 to 2022. And today I'm just here to share my story and shed some light on the global health concern that TB continues to be. This is because, unfortunately, it doesn't receive the attention from political leaders around the world, including here in Canada. And my story sort of highlights that, since I did end up getting TB like internationally and dealing with it in Canada. So my journey sort of began in 2020 when I was in Malawi. I was working there at the time, and at the point I just finished my master's degree. I received a job at a research institute and thought, why not just move to Malawi? It was, however, 2022 wasn't the best year probably to try to move globally, but 2022 had different things in store, and the world was in shambles from like this COVID-19 pandemic that had just come up, and there was also this like air of uncertainty in Malawi with a few political problems. It was a stressful time to probably move there, and I was also just alone. A few months in, I felt really sick, and I was experiencing pretty bad. I was fairly lethargic, and I lost my voice and really thought I had high fever. I went to a couple hospitals. They all cleared me at the time and just sort of told me that I didn't seem that sick. I didn't have malaria. I was probably just stressed due to all of these things. Um, a few weeks later, I ended up coming home, given all of the borders closing internationally. And my parents, who are sticklers for the rules, did follow the COVID-19 like government isolation protocols, sort of locked me in the basement for 2 weeks, which to their surprise was probably a really good thing, because I ended up feeling better after 2 weeks of them just delivering food and me sleeping, and they never got sick, which is a pretty big positive considering I live with a fairly large family. Fast forward to 2021, I never really thought about that, those 3-4 weeks again, but fast forward to 2021, I was accepted into a PhD program in the US, and I needed to do a TB skin test given my travel history, and was required, initially dismissing it as a mere formality. I went on to a travel clinic, completed the test, it came back positive. I really still didn't understand what I had gotten myself into. I blindly followed the instructions, not thinking about what had just happened. And I went and I got an x-ray done. The next morning, I think I was sleeping, and I just wake up to this phone call saying, "Is this Monica?" And I was like, "Yes." And they're like, "Oh, this is a TB clinic from Edmonton. I think you have active TB right now. You need to start isolating immediately." And honestly, I was so confused. I felt fine, and they just told me I might have this like deadly ancient disease. and we're dealing with a different pandemic. It just felt so overwhelming. And this marked the beginning of frequent visits to TB clinic, which included so many blood tests, x-rays. I had 2 bronchoscopies, and I had ultimately received a diagnosis of subclinical TB, like 9-10 weeks after my original skin test. I was very fortunate in the fact that I had a fantastic medical team. So though it took me 9 weeks and it was a really stressful time, I had made, like, the TB clinic and all of the doctors that I ended up working with were extremely kind. They were very compassionate and really took time to understand all of my questions. They even provided me with details on why they were recommending certain tests and procedures over others. They really tried to make sure that I was comfortable. I think they realized from our first meeting that I was really stressed. I didn't know what was going on, and I do ask a lot of questions. It's just something that's in my nature, but they didn't dismiss anything or make me feel like I was taking too much time. Even with having this extremely isolating disease, I was fortunate enough to not feel alone. Being that nobody really in my circle knew, like, had or had TB. And then even because of this, I still talk to my doctors today, and they have helped me try to incorporate certain aspects of tuberculosis into my PhD work, which is not medical whatsoever. I'm actually doing a PhD in econ. But it's sad to say that this isn't it's sad to say, but this extremely fortunate experience I had isn't the norm for most people. Most people don't receive a very similar level of care, which by no means is the fault of one particular doctor, and more so of a poorly equipped system that just doesn't have the capacity to provide this type of care. Beyond the traditional scientific, requirements or advancements, things like the availability of drugs, hospital doctor capacity, and adequate contact tracing are quintessential in reducing and eliminating TB here in Canada, and for that matter, the rest of the world. So all of these things can be improved with greater, like, funding, political will, just, marketing, as you might think. COVID got so much funding, got so much notoriety that, it's interesting to see that a disease that continues to be a problem, like, has remained a problem given these small limitations. Therefore, I call on the government to ensure that these things are possible for all TB patients, and in doing so, ensuring that the government stands by its commitments to achieve the goals of eliminating TB. And then more so, even through my engagement with the Stop TB Canada and the TB People Canada group, which continues to affect TB in Canada, I've been able to share my story and I hope help influence advocacy outcomes as we work towards raising awareness for TB, mobilizing affected communities, and promoting action. It is through the involvement and the consultation of people with lived experience that you're actually able to address this problem, even if that experience is positive. Like, I had a great experience, and I hope that people in the future are privileged enough to feel the same. And that is all I have. Thank you, Leigh. I'll give it back to you now.
Thank you so much, Monica, for this testimony and sharing your story, and also for your ongoing work as a passionate TB advocate. Personal stories add so much weight to our advocacy, and I really echo your point about the importance of including people with lived experience in TB work. We're really grateful to have you part of our mission. I think Monica's story emphasizes the diversity of experiences behind the numbers. We all often hear that over 10 million people are affected by TB every year, but it's really important to remember that each person has their own story and their own experience with this disease. So thank you again, Monica. To expand on this narrative out to the global level before we hone back in on Canada, we have Dr. Luchika Ditu, the Executive Director of the Stop TB Partnership, to talk about the global fight to end TB, including the United Nations high-level meeting on TB that took place last year, and some tangible next steps for where we go from here. Unfortunately, Luchika couldn't be with us live today, but has submitted a short video address to provide some context and inspiration for TB advocates ahead of World TB Day. So hopefully when I share this, the sound and everything works, but just let me know if you cannot hear her in 1 minute.
Hello, dear friends. It breaks my heart that I had to do this video and not join online as I wanted to do. But actually, this your meeting, and you can use it to, call all the positive forces, because exactly in the same time as your meeting, there is a conversation of the Strategy Committee of the Global Fund on the future allocation. And as you know, it's time for Global Fund to change its allocation for TB from the pathetic 18% to a much larger percentage to really represent or reflect the drama that we go through with the TB response. So I had to attend that meeting, so I decided to be there and to record this message, and I apologize for that very much. I want to start by saying that actually we have some good premises for the TB response if we maintain the political commitment and if we increase the funding. And why I'm saying this is because, as you all know, in September in New York, we had the UN high-level meeting on TB. And I think from all the meetings that took place in September 2023, TB had the best and the most concrete political declaration. We have very clear targets and commitments, numeric ones as well as qualitative one. We have very clear number of people with TB that have to be diagnosed and put on treatment by the end of 2027. We as well have numeric targets around preventive treatment, around drug-resistant TB, and so on, and children with TB, and so on and so on. We have very clear commitments around ending stigma, around having programs that are focused, gender sensitive, and embracing key and vulnerable populations. We have all the things there, so we have with what to work. And from the Stop TB Partnership side, we actually took the very large and complicated declaration, and we did a digest of it, which is online with very few pages. And also we took these global targets and unpacked them per region and per countries to especially being the base of a communication we are having now with all the countries, to ensure that everybody receives an estimate of what should be their share of the global targets, because every single country will have to contribute to achieving these numbers. And we encourage the countries to either embrace that numbers or develop their own numbers, but for sure that their future national strategic plans, as well as applications for donors, should reflect their share of the targets if we are really serious about ending this disease. On top of the fact that we have with what to work, because the political declaration of the UNHLM was endorsed by countries and governments, heads of states and ministers of health, we also observe something that, to be honest, makes me very happy, because this is not an estimate, this is real life. A significant number of high burden countries buckled up, as I say, and in 2022, and we know that in 2023 as well, and we hope that 2024 will be nothing less, they really pushed hard and advanced so much with the rollout of tools and interventions that the numbers of people that are missed, the famous number that is the difference between how many people are estimated with TB and how many people are diagnosed and treated at country level, that gap is narrower and smaller and smaller and smaller. And according to our Stop TB Partnership estimates, in 2023, we'll go even below 2 million people being so-called missed, which we never had in our life. We know already 2022 was the best, and we had the formal data. We still need the formal data to come for 2023 from WHO. But from what we see, and because of the big push of big countries with like India, Indonesia, Philippines, Bangladesh, Pakistan, Nigeria, South Africa, Ethiopia, the push of these big countries in getting almost all their people with TB diagnosed and treated through smart ways of doing campaigns to find everyone, shows that is feasible. So the programs, not only that are resilient, not only that they recovered after COVID, went far and above and beyond, which shows that the ambition is there, which shows that it is feasible. But we, of course, need the resources and need the attention to address this. And speaking of attention and the resources, I want to emphasize and thank Canada for the leadership at the global level in pushing the TB agenda towards ending it, and also for obviously having the very smart approach on basically funding through TB Reach innovations in the TB space. I want to say that TB Reach and the way that TB Reach grew up and evolved in several different spaces is the only platform that I know in global health, not just in TB, that basically tests proof of concepts in service delivery, in new tools, and in new approaches. So we looked a lot at civil service delivery. We looked at tools such as digital adherence technology. We looked at GeneXpert, MoldBio, and of course, artificial intelligence and use into X-ray. A lot of testing happening these days as well for different tests for TB infection and so on. None of this would have been possible without the efforts of Canada. And I really hope that this engagement into the global TB response and in specific interventions that can take our agenda forward will remain. I want to thank the government of Canada and our partners and advocates that make this possible. And I really hope that we will together tell to everyone that yes, we can end TB, but also that we will end TB. Thank you very much.
Yeah. All right, so thank you, Luchika, for providing those energizing remarks. Luchika always manages to leave me feeling really motivated and inspired to take action, which is a great segue to our next speaker, who will provide an overview on the work that Stop TB Canada has been doing and continues to do to ensure that Canada is really pulling its weight to help reach TB elimination, both in Canada and abroad. So now I'm going to pass it over to Tina Campbell, co-chair of Stop TB Canada and a TB advisor with Northern Intertribal Health Authority. Tina, over to you.
Good morning, everybody. It's an honor to be here today with so many great advocates in the fight against TB. Thanks for the introduction, Lee. And as you mentioned, I'm always so inspired after hearing Luchika talk. Tensei, my name is Tina Campbell. I am a registered nurse and currently work as a tuberculosis advisor at Northern Intertribal Health Authority in Prince Albert, Saskatchewan, on Treaty 6 territory. My organization serves 33 on-reserve communities in the northern region of Saskatchewan. Unfortunately, our region is currently facing outbreaks of tuberculosis in some of our communities, with the first one being declared in October of 2021. Prior to coming into this role in 2019, I was providing frontline TB care in Nunavut, another region that is currently dealing with ongoing TB outbreaks. Together, I have over 13 years of experience serving populations that have the highest rates of TB in Canada, including remote and isolated communities that are mainly populated with Canada's Indigenous peoples. I also have a strong personal connection to TB. Not only was I diagnosed with latent TB when I was 23 years old and went through 9 months of treatment for this infection, but the history of TB in Canada is also a history that is woven into my family's history. My kukum, which is grandmother in Cree, my Indigenous language, was sent to a sanatorium located in Fort Qu'Appelle, Saskatchewan, twice in the 1950s. My aunt, who was under the age of 10, was sent to the same sanatorium during the same time as my kukum. Here at this facility, the adults and children were separated and forbidden to interact. Experiences of abuse, force feeding, experimentation, and isolation were shared with me. During this time, when doctors visited Indigenous communities, those who were suspected or found to have TB were not permitted to collect belongings or say goodbye to family. And some, unfortunately, were never seen again. And for Indigenous peoples, this generational grief is still present. Mistrust and negative feelings of healthcare and institutions are a result. This is an ongoing challenge that I face when delivering care, and one of the reasons why I advocate for all healthcare providers to understand the importance of culturally appropriate care. Within my role as co-chair of the Stop TB Canada network, and given my diverse experiences as a TB nurse, a TB patient, Indigenous woman, and a family member of several people who have been affected by TB, I was selected to represent Canadian civil society at the multi-stakeholder hearing in preparation for the United Nations high-level meeting on TB that took place in New York City last year, that Luchika mentioned in her video. I use this platform to share my personal and professional experiences with TB and convey the urgent need for UN member states, including Canada, to increase their efforts to end the epidemic of TB that continues to devastate communities, including the ones in northern Saskatchewan, where I work and live. Stop TB Canada and our partners were deeply involved in advocacy for months leading up to the UN high-level meeting on TB last year. We knew that this would be an important moment for Canada and other member states to recommit to TB elimination on the global stage. We engaged in a variety of activities to increase public and political awareness of our calls to action, and met with a diverse range of TB stakeholders across Canada. Throughout this campaign, we were calling on Canada to step up its efforts to reach TB elimination by taking two main actions. The first was to increase its investments in research and development for TB. This ask is really about funding the development of new tools that are desperately needed to improve our ability to address TB. This includes developing a new, more effective vaccine, developing accurate point-of-care diagnostic tests, and developing shorter and safer TB regimens, and ensuring equitable and rapid rollout of these new tools once they become available. The second ask was for Canada to announce the establishment of a national TB elimination strategy. This ask is about ensuring that all relevant stakeholders and ministers across federal and provincial jurisdictions, as well as Indigenous leaders and TB-affected communities, are coordinated and working together towards a shared vision of TB elimination across Canada. Canada did attend the UN high-level meeting and announced a recommitment to the Stop TB Partnership's TB Reach initiative, which Luchita mentioned in her address. This program is essential in ensuring that people affected by TB in hard-to-reach communities around the world can access the care they need and that might otherwise go without. We celebrate this commitment, and it was the focus of our World TB Day campaign last year, and it is a critical component in the global TB elimination toolbox. We also celebrate Canada's involvement in influencing the language and commitments included in the political declaration that came out of the UN high-level meeting. Canada pushed for the inclusion of strong language on the rights of TB-affected communities and people-centered care, for example, which is something that Stop TB Canada advocates for continuously. Canada did not, however, come to the UN high-level meeting with those announcements for TB research and development funding or a national TB elimination strategy. And so this is something that Stop TB Canada and partners are continuing to call for. In the months following the UN high-level meeting on TB, Stop TB Canada sent letters to relevant federal ministers, including Ministers of Health, Indigenous Services, Immigration, and International Development, to bring TB to their attention and to remind them that TB elimination is within their mandates. We have since had introductory meetings with the Minister of Health's office, as well as 2 productive meetings with representatives at the Public Health Agency of Canada. We are encouraged by their willingness to connect on cross-cutting issues, such as a national TB elimination strategy, and hope to see progress and action on this initiative. Apart from the direct advocacy and decision makers, Stop TB Canada also works to hold the government accountable to previous commitments, and we have a really great tool on our website called the Canadian TB Tracker to support this advocacy. This tracker is an accountability tool that compares the commitments Canada has made to TB elimination with the actions that Canada has taken to fulfill those commitments. My colleagues are currently working to update this resource with the latest data and commitments made by Canada. And this updated version of the tracker is expected to be on the website by World TB Day this year. You can also expect to find it on Stop TB Canada's next newsletter, which is scheduled to be sent out at the end of March. Thank you to everybody who has joined our advocacy campaigns to push Canada to be a great leader in the quest to end TB at home and abroad. Now I will pass it back to Lee to introduce our panel of Stop TB Canada Steering Committee members to share their reflections on where to go from here. Thank you.
Thank you so much, Tina, for summarizing Stop TB Canada's efforts over the past year, as well as providing some context on why this work is so important through sharing your personal story and family connection to TB. We're really grateful to have you as co-chair of this network. And thank you again for joining. And now I'm going to turn to 3 members of the Stop TB Canada Steering Committee for a panel discussion on, as Tina mentioned, where we go from here. So Monica Shandel, who we heard from earlier on the call, will be joined by Madeline Nash and Dr. Yasin Cholikov. Madeline Nash is the Assistant Director of Policy and Engagement for Smart for TB at Johns Hopkins University, where she guides global and national specific policy recommendations and ensures representation of affected communities in TB research and policy translation. Her work in TB over the past decade has spanned academic, government, and nonprofit sectors. While at the McGill International TB Center, her research focused on the evaluation of innovative diagnostics for TB and HIV. In 2017, Madeline co-founded Sea Change, a nonprofit that supports communities to lead responses to their own health crises. And most recently, she worked for the Canadian government supporting TB outbreak responses in remote communities. Yasin Cholikov works as a public health physician in Nunavut and has an appointment as an assistant professor in the Department of Global and Public Health at McGill University. He has been involved in global health advocacy for more than a decade and has represented numerous health professional organizations in front of the United Nations. Yasin is passionate about health equity and this has driven his career choices and volunteer engagement. So thank you all for joining our conversation today. The first question builds off of what we've heard so far today and is intended to set the scene on why TB continues to persist in every region of the world. And I'm going to direct this question to everyone, starting with Monica. So Monica, in your opinion, what is one key barrier to reaching TB elimination?
Yeah, so there are a bunch of barriers, but what has already been highlighted, such as like funding and not actually having the means to care for patients, but from a patient perspective and actually going to seek treatment or take a test, I think that stigma also still plays a really big role. You're pinned with having a disease that a lot of people don't know about, especially here in Canada. So this brings up this like big idea of like, oh, I don't want to go get tested. It might really jeopardize people's willingness to go participate in from that perspective as well.
Absolutely. Thanks for sharing. Madeline, over to you.
Thanks, Lee. Thanks, Monica. Thanks, everyone. Really glad to be here. Yeah, it was challenging. I think we're facing a lot of big barriers in Canada, so to pick just one. But if I had to pick one, it would be this, because I believe it's really foundational to all the other things we need to do to eliminate TB in Canada, and that's really invest in community-led and community-based initiatives. I think that investing in and supporting these initiatives that are led by community groups and are based within communities, especially led by Indigenous, organizations or people living in community. This is the only approach that's gonna, especially in the Indigenous context, really help heal the historical trauma that is related to the past colonial interventions on TB, which Tina spoke so poignantly and elegantly about. And it's involving the community that's really going to be the only way to tackle that barrier to actively engaging communities in TB elimination so that they can take ownership, over addressing this this issue within their communities. And I think part of that also means involving and capacitating community members to be involved in delivering culturally safe care within communities, within a team-based approach, and using that as a strategy to increase not only, the numbers of people receiving care, but really the quality of the care that they receive. And I think just to say one more thing, this is really a tried and true approach that's been used globally for a range of different health issues, especially HIV, but absolutely TB. And I think Canada would really do well to sort of look elsewhere to see how we can adopt, successful innovations in our context. And I think there are some really relevant examples, like for instance, the community-based approaches that have been used in Alaska, which has a very similar, remote northern Indigenous population, and they've been able to really, impact the TB epidemiology in their setting by employing this community-led and community-based approach. So that would be my number one.
Great, thank you for that, Madeline. And I love how you're already getting to the potential solutions as well. Yasin, over to you for your one key barrier to TB elimination.
Yeah, I guess if we start at the international level, I guess the fact that the greatest TB burden is often contained in countries and in communities that have less resources would be one of the important one. I think that the hopeful thing, as Luchika outlined earlier on, is that we're kind of starting to get those newest and best ways of approaching TB to those communities. They're getting access finally to those. But for a long time, the access was very difficult, and people relied on essentially, and we still rely essentially on very old technologies for TB. When we're talking about vaccines that are 100-year-old, diagnostics that are decades old, we're still kind of trying to move ourselves forward in the science of TB. But unfortunately, even when we do, the places that have the biggest burden, that have the most to gain from the implementation, often don't have access, essentially for financial reasons. And I think that this is what's slowing TB elimination at an international level. And the same can be said for Canada. I think the majority of the country probably doesn't know about TB because the burden is so low most places. But the communities that have a lot of TB are often the ones that are actually still plagued by a history of colonialism, and still the remaining challenges of colonialism, and still have a difficulty of enacting the things that those communities want, because they're very mobilized. They have people there have the desire of addressing the health issues that affect them the most, and TB is sometimes one of them. But then there's a bunch of structural barriers to overcome, which wouldn't be there in other communities. So it's not just starting with a greater disease burden, but having the same access. Starting with a greater disease burden, having less access to resources than other communities in Canada. So yeah, so that's it. Maybe one quick comment around community-led engagement. I work in Nunavik, and we're working hard to try to develop or to give resources. Actually, the desire is there, but to find ways of giving resources and pathways of facilitating community level engagement through things that we call public health officers, but that essentially look like a community health worker. What is that term is used elsewhere. So trying to create that so that people that know the community best can actually lead some of those efforts and input into how things are done, rather than people from outside that don't know how things are done suggesting ideas. Yeah, that's it. Thanks.
Thank you so much. All three really powerful answers. So I'm hearing, among other things, the importance of addressing stigma, supporting communities, and enabling culturally sensitive care, and then also ensuring that the necessary funding is available to actually act on those those issues. Okay, so for the next question, I'm going to pose it first to Madeline and then Yasin. And I'm wondering what you would say should be the priority of focus to put the UN high-level meeting commitments into action. So I'll start with you, Madeline.
Thanks, Lee. So I think twofold, absolutely, investing in TB R&D like Tina spoke of, and Canada meeting its fair share target for investment in TB R&D is absolutely critical. And, important to reflect on the fact that, in 2022, we only met just half of that target. And if we look at the sort of renewed and elevated targets set by Treatment Action Group and Stop TB Partnership and others of 0.15% of funding, that investment in 2022 would have only been 25% of the new target. So we clearly, have a long way to go, and not just in TB and R&D, but if we look at, budget 2023, the really small amount of funding, 16 million or so dedicated to reducing TB, and the fact that that was restricted to Inuit communities, I think it's not enough resources, and it ignores the rising rates of TB in First Nations and other Indigenous communities in Canada. So resources, absolutely. And just to build upon that, I think it's really important that Canada looks hard at how we're aligning our domestic action with global commitments. It was great to see that Canada renewed its investment in TB Reach, to the tune of $25 million. But it's got me thinking, right, where is that proportional investment in strategies here at home? And when you think about the mission of TB Reach, right, innovative approaches to increase the number of people diagnosed and accessing treatment and all of those things, that's what we need in Canada here as well, in addition to addressing social determinants of health, of course. So I think it's great that Canada is investing in TB elimination globally, as they absolutely should be. But I would like to see, greater alignment with our domestic actions in terms of what Canada's doing globally. And just to wrap up, I think that funding and investment is only one part of it. As many of the speakers alluded to, I think access to innovation here in Canada, particularly access to medicines like rifapentine, like pediatric formulations, Canada is investing millions, hundreds of millions of dollars to scale up those innovations in low and middle income countries. And again, great, as they should be, but I think they have an equal, if not greater, obligation to ensure those innovations, like new pediatric formulations for rifapentine, like rifapentine for adults, like new first-line MDR TB drugs, like pediatric formulations for first-line TB treatment, need to be available to people affected by TB here in Canada. And letting market forces and capitalist forces drive the lack of access in Canada, I don't think is really an acceptable answer. And the government has an obligation to figure out solutions to enable access for people in Canada who are affected by TB. So increasing investment and aligning domestic action with global commitments. Thanks.
Great. Thank you so much, Madeline, for that really articulate answer. And I love how you're pointing to areas that Stop TB Canada is currently advocating for, including the increased funding for TB R&D and the access to meds issue here in Canada. So definitely wholeheartedly agree with you, and I'll pass it over to Yasin.
Yeah, not much to add to Madeline's answer. I think the one thing that actually builds on it is there should be alignment between what we do internationally and what we do nationally, and there should be also alignment between different sectors and between different ministries, because we often see certain actions that are deployed by the government or by kind of instances or other public institutions in health that are not fully aligned with what's done in other sectors, for instance, in IP or in trade. There's a lot of the barriers that are kind of internationally constructed that are hindering everyone from having access to the best of what we have in TB are essentially trade barriers. And we have a good recognition at the international level that those barriers shouldn't be a hindrance to responding to public health issues, but no political motivation to actually making use of the flexibility mechanisms that are already built in the agreements to allow that use. And this is somewhere where Canada could actually lead. So yeah, aligning coherence between different sectors that the single government is working on, making sure that we all work towards the same goal, not that some ministries towards one and others towards another.
Absolutely. Thank you for that, Yasin. I hope that everyone is feeling motivated by those kind of tangible things that Canada can be doing. And if there are any decision makers on the call, maybe you can bring that forward. Advocates on the call, join us in really pushing for these actions. And then the last question I have is going to go first to Yasin and then back to Monica. And I want to know what gives you hope for a future free of TB.
Yeah, I hinted that in my first answer. I guess the fact that we see such mobilization at the local level, and that essentially it's a very big motivating factor when we're working in TB, well, at least in the community where I work in Nunavik. The fact that people want to actually engage and want to do proactive things, and that essentially we're there to remove barriers and to help them get that motivation into something productive for their community is very motivating. So that's the one thing. And I guess the other thing is kind of the more scientific thing, the fact that we're seeing a lot of progress and a lot of investment, and that hopefully we'll have new tools in very short time, new ways of diagnosing TB, new preventive things for TB, hopefully a TB vaccine that will work for adults, maybe new and improved, shorter, better treatments. All of that is kind of in the pipeline, and it feels like it's almost in reach. And once we have it, maybe we'll be able to accelerate some of the progress that we're already seeing. Thanks.
Thanks, Yasin. And over to you, Monica.
Yeah, I think mine is mostly just reflects on the fact that there is this movement of like, on the ground people, be that TB survivors, advocates, medical people. Lots of people are engaged, like being involved in this group has showed me that lots of people are engaged in this conversation. It might not be like millions of people that I know of, but it's like a small but very powerful group of people that you'll see at the same webinars, the same meetings. So it's really nice to see that people are like actively very engaged. And I do see that there are like huge returns to what they're doing. Even just, I don't know, like the Hank Green thing that happened when he was like advocating for TB, like even the fact that it's getting this type of attention is really helpful in raising awareness, making people more cognizant of the fact that this disease still exists, especially at a time where all of us are consumed with the idea of like a recent pandemic, and they don't realize that this ancient pandemic has continued.
Thank you. Thanks for helping us end on a bit of a positive note. So I'm hearing that there is optimism in the TB space, and groups like this are part of that. From Stop TB Canada's perspective, we're really leaning into this positive sense of community that was mentioned by Monica, both through the support of our wider network and engaging in advocacy, as well as continuing to support TB People Canada, our group of people affected by TB here in Canada. So we do have time for some questions for our panelists. So please use the raise hand function on Zoom, or you can type your question in the chat, and please just indicate who you are directing your question to. Robin, go ahead.
When there's silence, you can always count on me. Yeah, I'd love to hear from all speakers if they could share some examples of best practices for effective and meaningful community engagement. I think that would be helpful from my perspective anyway. So to all speakers, if you could just share some real world examples, that would be helpful.
Great question. Who would like to take that one first?
And maybe even some like don't do's, if there's like best practices or like for sure don't do's, either or.
Madeline, I see you're unmuted. Oh,
Go ahead, Yasin.
Yasin and then Madeline.
Okay, I'll start as probably the least expert in this. Then that way I ensures that the others have much more to say. I guess what from the experience that I have in Nunavik, I think that what we've done is essentially try to build networks of people who are interested over time. So initially it was few people, they spoke to others, brought other people in, and now we have a few different ways of engaging different kinds of groups that are quite now no longer driven by us trying to engage with people, but by the people, them trying to actually have their own advocacy and then moving us and pushing us to actually help them out in the things that they do. But it's something that takes time. So I guess maybe a lesson learned is giving it time. But essentially, if you're not from that community and you want to engage, it's maybe creating a space where people can then actually use a safe space that they can use to actually discuss things between each other and bring back to you, and repeatedly creating that space until things actually continue by themselves.
Yeah, to build on that, I think I've worked on community engagement now from two, I think, very important but different angles. One is really in a kind of more programmatic, education capacity, like involving community members in care and in, strengthening literacy, TB literacy in communities, and then also from a perspective of research and having communities engaged in the design and conduct of clinical trials. And I think, just thinking about it now, I feel like two key best practices that apply to both contexts would be, early and supported. So I think that you want to, and maybe it's a little bit obvious, but obviously you want to start that engagement process as early as possible. And I think wrapped up in this is the idea that you can't come into it with an already baked idea. I think that sometimes, in a worst last case scenario, it's better to get some input than no input, but to go in with already, the approach and then just be getting feedback is not as ideal as to go in completely open and say, what are your priorities? What do you see as the main issues? How can we help support to address those issues? And in my experience, that's been like the most effective way to really build strong collaborative relationships and address the fundamental priorities of communities, because it was a really big, humbling lesson to learn that the things that you think might be a priority of any given person or community might be completely discordant from like what they're facing. And I think that comes up a lot in TB. Like we come into these situations thinking TB must be the biggest problem facing this person or this community, when really it's like they don't have a job, or their roof is leaking, or they have loss in their family. And I think that being cognizant and humble enough to know that you don't know, even if it might seem obvious from the outside. So that's kind of the early bit. And then supported is, especially in the work that I'm doing now with engaging communities in research design, it's not enough just to say, we want your input and we want your involvement. I think it's the responsibility of, the person who is soliciting the input to create the supportive structures and environment and training so that community members or groups can really engage from a fully capacitated and supported way. So whether that just means like providing webinars or resources, or like Yasin said, taking it slow and building in time to build that capacity and have that exchange. I think those to me are two of the key best practices. And I think within that, there's some probably obvious don'ts that boil to the surface.
Thank you both so much. Monica, I see you're unmuted if you wanted to add your thoughts. And there's also kind of a complimentary question from Elizabeth in the chat, wanting to hear more about your perspective on how we can tackle TB stigma.
Yeah, so I actually don't have much to add to the last question. I was just going to say that having that space and dialogue is really important. And then, yeah, Madeline talked on that. So I will just move on to the next question. But yeah, in terms of TB stigma, I think it's important. I think it builds on actually the last answer, that it's important that you, as like a physician or your medical team from a patient perspective, like just so there's like, I'll give it an example. So one time when I went to I was having a really bad allergic reaction, not to the drugs, but to something else while I was taking my medical treatment. And all the response I got from like the allergy clinic was, you're a TB patient. That's the only thing that this can be a part. Like, that's the only effect. You're a TB patient. I had seen TB patients in Africa. I know that this is like what this, like, I can't give you an answer, but you're just because you're a TB patient. And it was sort of like this cop out that I got a lot from a lot of medical people at the time, saying that, oh, but it turns out it was something a lot bigger that I was just dealing with tangentially to tuberculosis. So having this whole like idea that, oh, this is like the whole thing, this is the only thing you're dealing with, isn't really helpful when you're trying to address like that. If anything, that made me less open to going to like more doctors or seeing other people. And then from like a non-medical stance, a lot of people were more concerned with themselves, like, oh, like, am I going to get sick? And I was like, well, I'm not going to be talking to you if you're going to get sick. People, I think, just don't understand that like TB still exists, and like all you hear about it is that you're going to be coughing up blood and like dying. So it's important that people are like aware that somebody is actually going through it, and it's, you know, extremely valuable to have like other people who have gone through similar experiences to go through it with you, to realize, oh, like, I'm not by myself. Like, I actually need to spend time and like explain what TB is to people, and that whole like education perspective of people who aren't directly associated with tuberculosis is also really important in addressing stigma.
Great. Thanks so much for sharing that, Monica. I did see, Madeline, your suggestion to get Tina's thoughts on best practices as well. Tina, did you have anything to add?
Yes. So following Monica's comments, when we're working with Indigenous populations, you know, she did say that people are just really not aware that TB is still around. And even though there are high incidences in the communities that I've worked with, for example, when I was diagnosed when I was 23, it was my first year of nursing school, so I had to get TB screening. And you know, it was routine. I thought it was odd because I thought TB wasn't around anymore. Little did I know that the community I lived in had a designated TB clinic. So of course there was a lot of TB. And I was terrified when I was diagnosed. I had no idea what was going to happen. And I felt a lot of guilt because I was like, did I potentially spread this on to friends and loved ones? But with that education, it kind of, you know, a lot of education lessened my worries, and I came to understand the disease process and exactly, and I just started to learn why we see so much TB in our remote and isolated communities, for many factors, and the historical treatment as well. You know, that continues to have stigma attached to TB, very negative stigma. And with these experiences that have been, you know, brought forward from survivors of TB sanatoriums and residential schools, you know, a lot of people still don't know that TB exists, or they don't understand the disease process and how it's transmitted and the factors that increase your chance of developing active disease. So our program really focuses on that basic education. And it might seem to others, oh, you're repeating it over and over again, but some people might not have the same understanding as others. And just starting with that, you know, saying that it was something that was brought to Canada, and unfortunately, you know, Indigenous peoples, you know, continue to suffer from this illness. But the fact that, you know, we do meet some people that think that it's passed down through their family, that it's something that is, you know, in their blood, like genetic, and we're like, no, it's not. It's actually a preventable illness, and we can eradicate it if we had, you know, the resources and everybody on board to do so. So that community engagement piece is really important for our organization, and we really deliver resources and radio messaging and, in Indigenous languages as well. So we have Cree and Dene in our region that is most commonly used. And as well, we have the privilege to have Indigenous nurses, TB nurses that speak the language. And some of our nurses have experience either being treated for TB as well, being sent to hospitals, and also have family members as well. So being able to talk about their experiences with clients, that helps them open up and build trust as well. We still struggle with, finding people to talk openly about their experiences, and I understand why. It's still, very hard to talk about my family experiences that were shared with me. And that mistrust, like I understand why that's there. And on top of, that education that we provide to the communities, I heavily push for healthcare providers as well, because, TB is scary to a lot of people, even healthcare providers, because they don't fully understand what it is. And so there's that as well. And also, yeah, it starts with the community. And every community is different from what I've learned. I started my practice up in Nunavut, and then down here working with several Indigenous groups. And every community is different with their needs, with their level of understanding. So you really have to go in and work with the community and the leadership, and kind of tailor your engagement that way. And I think I'll stop there. I can talk all day.
Thank you so much, Tina. And thank you again for all of the important work that you're doing. I can't emphasize enough how important it is. So always love to hear about your work. Do we have any more questions? We have just 2 more minutes on the call. If not, I will just take the time to thank all of our speakers who joined us today, and for everyone who took the time today to take part in this World TB Day webinar. We intentionally scheduled it about a week out from World TB Day so that we could use it as an opportunity to remind you of all the actions that you can take to help us raise awareness for TB and help us commemorate World TB Day. So firstly, I would encourage you all to take a quick action with us right now. We can take to social media to raise awareness for TB. We have a pre-drafted tweet that you can access through the link in the chat, and encourage you all to share our social media toolkit, just getting the link for that as well. That conveys the 2 asks of Canada that Tina articulated earlier. So for increased funding for TB R&D and the establishment of a national TB elimination strategy. So you can access that Google Doc, and it has pre-drafted messages as well as graphics that you can share on social media. And then next, I would invite you all to visit one of the monuments that will be illuminated in red this World TB Day on March 24th. So some of us are going to be visiting monuments and taking photos of the monuments that are lit up in red, posting them on social media with messages about World TB Day. I will share a spreadsheet that has information about all of the monuments that are going to be lit up in red this World TB Day, so you can see if there's one that's located near you, and we would encourage you to visit. I can also share this information and all of the links that I've shared in the chat today in a follow-up email. With that, I'll just end by saying don't hesitate to reach out if you have any questions. You can always reach us at hello@stoptbcanada.com or visit stoptbcanada.com to learn more. Thank you so much and enjoy the rest of your day.
Thank you.
Thanks, everyone.
Thanks.